Diagnosis of hypertension. Diagnosis of hypertension is generally on the basis of a persistently high blood pressure. Usually this requires 3 separate measurements at least 1 week apart. Exceptionally, if the elevation is extreme or end organ damage is present, then the diagnosis may be applied and doctors will commence the treatment immediately. Blood pressure can be affected by several factors, so it is important to standardize the environment when blood pressure is measured. For instance, measurements should be done at least 1 hour after caffeine, 30 minutes after smoking or strenuous exercise, and without any stress. The patient should be sitting upright in a chair with both feet flat on the floor for a minimum of 5 minutes prior to taking a reading. Blood pressure is usually measured while you are seated with your arms resting on a table. Your arm should be slightly bent so that it is at the same level as your heart. The upper arm should be bare, with your sleeve comfortably rolled up. To obtain your blood pressure measurement, your healthcare provider will wrap the blood pressure cuff snugly around your upper arm, positioning it so that the lower edge of the cuff is 1 inch above the bend of the elbow. The healthcare provider will locate the large artery on the inside of the elbow by feeling for the pulse and will place the head of the stethoscope over this artery below the cuff. Your healthcare provider will close the valve on the rubber inflating bulb and then will squeeze it rapidly to inflate the cuff until the dial or column of mercury reaches 30 millimeters mercury, higher than the usual systolic pressure. If the usual systolic pressure is unknown, the cuff is inflated to about 210 millimeters of mercury. Next, the valve is opened slightly, allowing the pressure to fall gradually 2 to 3 millimeters of mercury per second. As the pressure falls, the level on the dial or mercury tube at which the sound of blood pulsing is first heard is recorded. This is the systolic pressure. As the air continues to be let out, the sounds will disappear. The point at which the sound disappears is recorded. This is the diastolic pressure. The procedure may be performed 2 or 3 times. Repeated measurements are important. A single high measurement does not necessarily mean you have high blood pressure. On the other hand, a single normal measurement does not necessarily mean that you don't have high blood pressure. In elderly patients who may show orthostatic hypertension, measuring BP while lying, sitting or standing may be useful. The blood pressure should at some time have been measured in each arm and the higher pressure arm preferred for subsequent measurements.